Good morning and welcome. Before we begin the hearing, I want to highlight that today at 3 o'clock in Emancipation Hall, a congressional medal that was authorized by the Senate and the House will be presented to the 6888, the African-American women who in World War II delivered the mail by the millions. And we would welcome you to participate, to attend, or at least honor those women today who served our country. It's a really touching story. I think a number of networks across the country have carried this story about these women who rolled up their sleeves and got the mail delivered to service members during World War II. Today we're on the topic of mental health and veterans' well-being. Nearly 5 years ago, the Commander John Scott Hannon Veterans Mental Health Care Improvement Act was signed into law. I led the introduction of this legislation with the help and support of many of the veterans and advocates that are here today. I also would indicate that this was a piece of legislation that Senator Tester was hugely engaged in. The Commander Hannon Act directed better collaboration between the VA and the Department of Defense and made improvements to the VA's mental health workforce and directed cutting-edge precision health research. This landmark legislation also developed and authorized federal funding for the Staff Sergeant Parker Gordon Fox Suicide Prevention Grant Program, which focuses on bolstering community organizations providing non-clinical suicide prevention services to veterans. It was the goal of Congress and this committee specifically for the VA to work more seamlessly with veteran-serving community organizations to provide veterans life-saving clinical care and non-clinical support services they deserve. This morning, we are here to discuss the non-clinical suicide prevention services and to hear directly what has worked well and what needs to be altered with the goal of reauthorizing this impactful program. We will hear from the VA to receive the department's perspective on implementation of this grant program. We'll also hear from advocates who represent grantee organizations for their perspectives and from veterans who have benefited from the program. Additionally, we will be receiving input from the VA and feedback from advocates on 4 bills, which include helping optimize prevention and engagement, the HOPE Act, which is my legislation, the Building Resources and Access for Veterans Mental Health Engagement, the BRAVE Act, sponsored by the Ranking Member Blumenthal, the bill to reauthorize and modify Staff Sergeant Parker Gordon Fox Suicide Prevention Grant Program, sponsored by Senator Bozeman and Warner, and Every State Counts for Vets Mental Health Act, sponsored by Senator Kramer and Senator Coons. With that, I yield to the Ranking Member, Senator Blumenthal, for his opening remarks.
Thank you, Mr. Chairman. Thank you for convening this hearing on this critically important topic. We're here today to discuss the issue of veterans' mental health, including their access to care from a safe, reliable provider. A safe, reliable provider who has the expertise and trust to provide the best possible care for each individual veteran. I welcome our colleague, Senator Warner, to testify on behalf of the Staff Sergeant Parker Gordon Fox Grant Program. It's been a game changer for so many veterans. It's geared toward meeting veterans where they are, providing access to services from trusted community partners and targeting underserved communities. And my hope is we'll have bipartisan support for reauthorizing the Fox Grant Program. And we will have bipartisan consensus on a couple of really essential points. The rate of veterans suicide, 17.6 a day, is absolutely intolerable. The level of services to veterans for mental health is woefully lacking. The efforts underway to address the lack of mental health are completely inadequate. And my bill on today's agenda, the BRAVE Act, reauthorizes the Fox program, but it goes farther. And I hope we'll have bipartisan support to ensure not only that this program, but others to address these issues are fulfilled. The fact is, the Veterans Crisis Line has seen a dramatic impact in call volume largely from veterans who were either terminated from the federal workforce or who are concerned about losing their benefits, or both. And at a time when veterans are uniquely anxious and apprehensive and need our support the most, we're seeing the Trump, Musk, Collins conglomerate slashing and trashing their way through the federal government. Employee assistance programs and mental health support contracts for the VA workforce have been canceled. Some have been reinstated, but not before employees were left high and dry and forced to choose between paying out of pocket or canceling their appointments due to contract cancellation. World-class researchers studying mental health and substance use disorders are among the ones who've been terminated. Makes no sense. It's nonsensical. It is shameful and disgraceful. On the issue of privacy, a recent memo obtained by NPR recommended VA mental health providers tell their patients, quote, "While I will do my utmost to maintain your privacy, I cannot guarantee complete confidentiality." They're telling veterans they can't maintain privacy or confidentiality due to space limitations caused by a rushed and reckless return to office mandates. Again, disgraceful, shameful. Concerns about privacy will destroy the hard-won trust VA has spent decades building. After this memo was disclosed, VA backtracked to say it was temporarily delaying its return to office requirements for telemental health providers. I want to note these providers haven't been exempted from the return to office mandate. The facilities have simply been asked to confirm their return to office spaces are private. This strategy of cut first, plan later, fire first, analyze later, terminate, cut, freeze, ask questions later, apparently is continuing. And this failure of leadership is at the expense of veterans, and we have yet to hear in this committee from the Secretary of the VA, despite my repeated requests for him to tell us what the rationale and reason is for these massive cuts and firings. So we all know that even before the Trump administration's crusade against veterans, the VA projected a 59% increase in inpatient and outpatient mental health care demand in the coming years. 59% increase. The department was already suffering from critical mental health staffing shortages. There were already 40,000 open positions in the VA, some of them for mental health professionals. In his confirmation hearing, the Secretary claimed suicide prevention was a priority. But instead of bolstering access to life-saving mental health, he's fired thousands of critical employees, including Veterans Crisis Line employees. Some have been reinstated. Others have found new employment. That's understandable because they have bills to pay. They have lives to live. And waiting for the administration to correct yet another unforced error can't be their burden. We have to make sure that the administration answers our question. Our responsibility is oversight and scrutiny, and to prevent the firing of another 83,000 VA employees over the coming months. We know from this committee, we've all been on it for a while, that outreach is essential to bring veterans into mental health. We can't rely only on veterans calling a crisis line or coming to the VA facilities. There has to be outreach. 10 of those 17 per day average veterans taking their own lives, 10 of them have had no contact with the VA. If we can reach more, we can save more. If we fire the counselors and others who are doing outreach, it will cripple efforts to save veterans from suicide, including the Fox program. So while we're here today, I hope to hear from our witnesses about the importance of outreach and how it can be bolstered and strengthened. Thank you, Mr. Chairman.
Ranking Member, thank you. We are now delighted to have before the Veterans Committee on a temporary basis the senator from Virginia, Senator Warner, one of our esteemed colleagues, and this is a rare occasion when other senators not on the committee appear before us, but you are welcome to be here, Senator Warner.
Well, thank you, Mr. Chairman, and Ranking Member Blumenthal. This is obviously a very important topic. You've given me 4 minutes. I'll try to hit under 4 minutes so I actually get asked back, but very much appreciate the work of this committee. I know the issue of mental health of our veterans is extraordinarily important. And this is something I think we all realize is part of a core commitment. This is not a nice to do. This is an obligation we owe to the men and women who've served us. It is not charity. It is something that we must fulfill. And unfortunately, as the chair and the ranking member, and I know all the committee members realize, veteran suicide is a scourge that has to be addressed. For the past several years, Staff Sergeant Fox Suicide Prevention Grant Program, I think, has been an invaluable tool for the VA to use. Senator Bozeman and I came up with an initial legislation back in 2019. A number of members on this committee were firm supporters. That turned into an effort that ultimately led to the Staff Sergeant Fox Grant Program. In that time, $150 million has gone out in my home state of Virginia. $4.5 million of that has gone out to organizations who are providing the kind of critical outreach to make sure that veterans who are in duress know that the services are available. As Ranking Member Blumenthal, we have a huge concentration of veterans down in Hampton Roads, and the fact that of these 17 suicides today, the fact that literally 10 of those never interact with the VA is a challenge that we have to overcome. This program was a temporary grant program. It is time for its permanent reauthorization. I've joined again with Senator Bozeman on legislation to do that. I know the chair and the ranking members and others on this committee have similar legislation. I just want to add my voice that this is something we have to get done. The sooner the better. Literally, veterans' lives depend upon it. And if in any way I can, as an off-committee member, help in these efforts, please count me as one of your allies. I appreciate the opportunity, and I will note, Mr. Chairman, that I am ceding back 1 minute and 40 seconds.
A message, it's an opportunity for senators to learn from Senator Warner, a message well delivered under the time allowed.
Thank you, Mr. Chairman.
Thank you, Senator Warner. Thank you for joining us today. I remember the hard work that you and Senator Bozeman did early on to get this legislation in place. Testifying on today's first panel is Dr. Thomas O'Toole, the Acting Assistant Undersecretary for Health for Clinical Services of the Veterans Health Administration. He is accompanied by Michael Fisher, Chief Officer of Readjustment Counseling Service of the Veterans Health Administration. Thank you both for being here. Dr. O'Toole, you're now recognized for your testimony.
Thank you, Chairman Moran, Ranking Member Blumenthal, and members of the committee. Thank you for inviting us here today to present our views on several bills that would affect VA programs and services, particularly the Staff Sergeant Parker Gordon Fox Suicide Prevention Grant Program. Joining me today is Mr. Mike Fisher, Chief Officer of the Readjustment Counseling Service. The Staff Sergeant Parker Gordon Fox Suicide Prevention Grant Program enables VA to provide resources toward community-based suicide prevention efforts to meet the needs of veterans and their families through outreach, suicide prevention services, and connections to VA and community resources. In alignment with VA's national strategy for preventing veteran suicide, this grant program assists in further implementing a public health approach that blends community-based prevention with evidence-based clinical strategies through community efforts. The grant program is part of the Commander John Scott Hannon Veteran Mental Health Care Improvement Act of 2019 that was signed into law October 17, 2020. The Staff Sergeant Parker Gordon Fox Suicide Prevention Grant Program began on September 19, 2022, when VA awarded $52.5 million to 80 community-based organizations in 43 states, the District of Columbia, and America Samoa. Since its launch in September 2022, VA has awarded $157.5 million to 95 organizations across these 43 states, U.S. territories, and tribal lands. Early results show that 33% of participants are new to VA services, and 75% of participants who complete services show improvement in mental health status, well-being, social supports, and financial stability, as well as a decrease in suicide risk. All of the bills on today's agenda would whole or in part amend the authority for the Staff Sergeant Parker Gordon Fox Suicide Prevention Grant Program. VA strongly supports the reauthorization of this program as it is critically important for sustaining and expanding the progress we have made so far. The initial grants have already shown promising results, and continued congressional support will be essential for ensuring that we can reach even more veterans in need. We greatly appreciate the committee's interest in continuing this program and stand ready to implement the extension of this authority as soon as possible, because it's important to continue this work in fiscal year 2026. We welcome the opportunity to meet with the committee to ensure that any amendments to the terms of the grant do not interrupt operations or delay these awards. The department's position for each bill is detailed in my written statement. This concludes my statement, and we're happy to answer any questions you or other members of the committee may have.
Doctor, we'll begin a round of questions by the members of the committee. Let me start by asking you, as Congress looks to reauthorize, and it's really pleasing. I think this has broad support in Congress and certainly strong support from the department. But as we do this process and work to improve this program, what's the VA learned about grantee performance and outcome data so far? And what are the lessons that have been learned in shaping your approach to suicide prevention? I would add, before you answer that, one of the challenges highlighted in the Hope for Heroes Act is the lack of awareness among VA staff about the Fox Grant program. And I would ask, how's the VA working to make certain its own employees, especially those in high needs areas, are fully aware of the program and collaborating with grantee organizations, making this program even better?
Thank you, Senator. As noted, the 3-year authorization for this grant program has really allowed us to be on a learning curve to try to do a better job. As has been noted, any suicide by a veteran is one too many. And so we very much view this grant as an important part for reaching those veterans that we are not reaching. The lessons learned to date, and much of this is captured in the MITRE report that provided a snapshot view of early experiences, highlighted several areas that we need to continue to improve on. Obviously, enhancing our outreach and engagement, particularly for those disconnected veterans, is critical. And I think ensuring that our grantees have all of the services they need, as well as the expectations and skills that they require to be able to effectively engage, not only in outreach, but in the services, is critically important. The other area that I think is essential is making sure that the VA is there, ready, and has capacity and a clear path for ensuring that mental health care is available to those veterans who need it. And obviously that incorporates several different elements, but one of which you mentioned, which is an awareness of the programs by the grantees. It's something that we acknowledge, and I know it's addressed in several of the bills going forward as well.
Let me ask, you used the word capacity, clear path. So how would you indicate that the Department of Veterans Affairs is prepared and capable on a clear path to reduce suicide by veterans in the country, just more broadly than this legislation? Tell me about the capacity and capabilities.
So the capacity is, we have a very robust mental health services program within VA that incorporates tiered levels of care, including screening throughout the agency and in our healthcare settings, not only just in mental health, integration of mental health care within our PACT or primary care teams through the PHMI program, behavioral health teams providing more intensive care, as well as specialized services for higher need, higher risk veterans, including inpatient care and residential treatment programming. It's a continuum of care and continuum of services that, as noted in Senator Blumenthal's statement, requires maintenance, requires an ongoing, capacity to effectively serve the veterans in need. But it is also, I think, a more robust service than oftentimes we can find elsewhere, and it's one that, I think our veterans benefit from greatly. Are there things we can do better? Absolutely. Are there things we need to be improving on? Absolutely. And, I'm not here to try to defend things that aren't working, but more importantly, be here to, commit to our ongoing work with the committee to do a better job.
What would be those things that you could do, that you see you can do a better job, aside from what we've talked a lot about, which is outreach?
Right. I think that, the Veteran Crisis Line, I think, has been a lifeline for a lot of veterans. We need to continue to be able to support that and do the best we can. What's critically important is clearly making sure that we have pathways to treatment and to ensuring safety for those veterans who do screen positive, and we actually do well in that capacity and support. Our ability to reach those veterans who are transitioning from the military is a critically important focus and capacity and interest, and I know it's one that our agency is working on several different efforts to try to improve and enhance. That becomes, I think, a critical piece, an element to it. It's also important to note that suicide risk extends beyond strictly a mental health approach and status. Oftentimes there are economic drivers, there are social drivers and others. And taking a whole health approach to the veteran is critical to really ensuring that not only the immediacy of a suicide risk is addressed, but sometimes the underlying issues and drivers of that suicide are also being considered.
I'd note that I've utilized Senator Warner's extra minute and a half, and I now recognize Senator Blumenthal.
Thanks, Mr. Chairman. I want to begin by thanking you both for being here and for your service to our country and to the veterans of America. I know that this time in your professional careers is probably one of the most challenging that you have encountered, not because of anything you've done, but because the leadership at the VA is slashing positions and freezing hiring and cutting funding that is necessary for you to do your jobs and accomplish the mission you've devoted your lives to doing. And to you and all of the professionals at the VA, I just offer my thanks for continuing to persevere in this very difficult time. Dr. O'Toole, you would agree with me that outreach is critical in preventing veteran suicide and enabling them to what you have called a pathway to treatment.
Yes, sir.
And that takes human beings on the phone or in a meeting. It can't be done by an automated message machine, correct?
Yes, sir.
What rationale, what reason could there be to cut those positions as is now happening?
Well, thank you, Senator, and I appreciate, one, your kind words as well as the attention that you're focusing on this issue. I am happy to report that actually the Veteran Crisis Line staffing numbers have gone up and not down since this last January. This is as you know, an exempted position from both return to office and along with 300,000 other direct care positions exempt from any hiring freeze or any firings.
Those returns or reinstatements were done after vocal protest from myself, others on this committee, in Congress, and across the country. So yes, that's good news, but it's not just the crisis line. It's positions in the West Haven facility, outreach, counseling. There already were 40,000 vacancies before this administration took over. Would you agree with me that a lot of those positions in the field are open now, and some people in those positions have been terminated?
Thank you. And I'm just up the road from you in Providence, Rhode Island, so I can appreciate the challenges of local staffing and local issues. Quite honestly, our challenges in maintaining the workforce in healthcare extend beyond the challenges that we're facing now. A lot of them.
I'm going to interrupt because I'm going to run out of time if I don't interrupt, so I apologize. But the fact is, there are challenges in recruitment, correct?
Yes, sir.
And those challenges in recruitment are deeply and dramatically aggravated when the prospect of firing 83,000 employees is raised. Why go to work for an institution that's about to fire probationary employees, the newest among them, when there are opportunities in the private sector where you get paid more? I mean, duh. You know, I know you're not in charge of personnel, but isn't that a recipe for disaster?
Well, sir, I can say that the 300,000 positions, which are the direct care positions, are exempted from any hiring freeze, and this is a critically important element to trying to ensure that we are retaining and ideally growing our workforce as best we can.
I am about to have my time expire, but I just want to say that we know that there have been firings of researchers, counselors, outreach personnel. There is simply no way to save veterans, and I've heard nothing here that would convince me otherwise, if we engage in this slash and trash approach to the VA. And again, my thanks to all the professionals, to you, Mr. Fisher, and Dr. O'Toole, for what you're doing. And I have not gone over my time.
Only by 3 seconds. Senator Kramer.
Thank you, Mr. Chairman and Ranking Member, for this important hearing. And thank you to our witnesses as well for your service and for being here. I'm going to get right to the specific point that's addressed in legislation that I've introduced, an amendment to the Act before we reauthorize it, that I've introduced with Senator Coons. To be clear, the result, what resulted in this is the fact that as important as this program is, and it is important, and I strongly support it, neither North Dakota nor Delaware received any of the funds, despite a very, very good application, particularly the one I'm most familiar with, the state of North Dakota, through the North Dakota Department of Veterans Affairs. Important, I stress, the North Dakota Department of Veterans Affairs, because of the 5 criteria, that meets 5 of them, the 5 criteria for the grant. And so we're a little disappointed, of course, that North Dakota's application was rejected. I don't know if it was not qualified, but at least wasn't prioritized. And so I want to, I'd like to have you, maybe explain to me a little bit about why that happened. And then also, we received the testimony yesterday that the VA is opposing my language and my amendment. And I just want to give you an opportunity to explain that before I try to explain my position better.
Great. Thank you, Senator. And while I can't speak to the specifics of that individual grant application, and the decision to it. I think it's important, first, thank you for your support of this. It's support that we're very appreciative of, and we share in our need and want and desire to really grow this program and grow these efforts. I think our challenge and our concern with an approach to increasing the number of grantees, which we acknowledge is important and it's an essential aspect to being able to reach more veterans, engage more veterans, and get more veterans into care and services, is going to be, it's a shared objective. Having two potentially different or a prioritized pathway would be difficult to logistically administer if we have two tiers. Our larger concern is that we want to make sure that all of the projects and all of the grants that are being approved are meeting a high-quality universal standard. And our concern was we do not want to create two standards for how a grant would be approved.
And I appreciate all of that. I would state, however, that in the case of states, and just to be, so that people know what our bill does, Every State Counts Act, it recognizes that a couple of states didn't receive funds from the program, and we want to prioritize states that haven't received funds previously. It's a one-time deal. We want to get these other states in the loop, so to speak, and then clear the deck. Particularly very rural states. I mean, North Dakota is a big state, 350 by about 200 miles, rectangle in the middle of the North American continent, literally. We have a monument to prove it. And a lot of miles between veterans, but 55,000 of them that need this service. We think that's pretty important criteria. I've done this before with other bills. Senator Heinrich and I did something similar when the discretionary grant programs at the Department of Transportation weren't reaching some rural states. We fixed that, got them back in the loop, and it's worked out very well. I would just state that particularly, again, I've read the objections. Some of them reference, multiple applicants within the state, the competitive nature, all the things that you've highlighted. But I think when it comes to an entire state, regardless of the small population, it is, after all, why there are two senators from every one of them, that every state does matter. Our founders made sure that. I just think it's worth fixing in a way that prioritizes states that have not received funding previously. And just adding that it's not complicated. I know the testimony says it's complicated. It's not complicated. It's very simple. And we want to make it simple. If we make it simpler, we'd like to do that.
Thank you, Senator. And we agree. We are very interested in working with the committee to figure out a good way to approach it because we share that same
And
objective.
I suspect more resources would be helpful.
Yes, sir.
Yeah. All right. I yield 10 seconds since we're keeping track.
Senator Murray.
Thank you, Mr. Chairman, and thank you to both of you for being here. I think it's really important that in order to improve our mental health care outreach, we need to hear, all of us, members of Congress, need to hear from both veterans and VA providers about their experiences and the issues that they face every day. However, last week, the Trump administration denied VA Puget Sound in my state the ability to both host and participate in my Women Veterans Roundtable. I held the roundtable anyway at a local VFW, but VA would not participate. And the conversation certainly lacked, in my opinion, a much-needed perspective. I have never seen this sort of blatant barrier of outreach before in my entire time of Congress. Dr. O'Toole, can you explain why having both the VA and veterans together is important for a robust conversation?
Well, thank you, Senator, and I appreciate it. I'm not familiar with the situation you're describing, so unfortunately I can't comment to that and to the specifics or to the approval or lack of. But Absolutely, we are informed by our veterans. It helps us be a better agency and a better organization, and it's something we try to encourage in as many capacities as we can.
Well, do you know if the new policy that prevents elected officials from meeting with veterans at VA facilities comes from within VHA, or does it come from political leadership at VA central office?
You know, I would have to defer that to our leadership in terms of, describing it better than I can myself.
Okay, well, Mr. Chairman, this is really important, and I really hope that Secretary Collins, who says he's running the most transparent VA in history, decides that VA can be transparent enough to let a senator hold a discussion about VA health care on-site at the local VA, as I have done for over 30 years. And I know other members have as well. So I am not done with this topic. Let me ask you, though, Dr. O'Toole, even though women are more likely to seek care through VA, they are also more likely to be dealing with depression and anxiety or sexual trauma. In 2022, suicide rates for women veterans with histories of military sexual trauma were 75% higher than those without. So getting in contact with these veterans and providing them the resources they need can truly be life or death. However, in February, President Trump and Musk fired more than 2,400 VA employees, including dedicated health professionals who staffed the phones at the VA Center Veteran Crisis Line. What steps is VA taking now to reach out to survivors of military sexual trauma?
Thank you, Senator. Well, first, in relation to the Veteran Crisis Line, that decision was reversed, and we have actually seen a net increase in staff working in the Veteran Crisis Line. And I'm happy to report that outcome. The outreach and specific efforts for women who are victims of military sexual trauma has been incorporated into our ReachVet and ReachVet algorithm, so that we are specifically identifying and engaging those women to make sure that we are providing better care. I'd like to defer to Mr. Fisher, who can also speak specifically to some of the efforts at the Veteran Resource Centers as well.
And thank you, Senator, for the question. So vet centers have historically gone out and reached out to any veteran cohort and service member cohort that's eligible for vet center services. That includes women veterans, that includes individuals who experience military sexual trauma. We've continued to do this since the change of the administration. Our outreach staff, as well as our counseling staff at vet centers, are exempted from any hiring freeze. And what we can say specific to women veterans is that we every year see increases in the number of women veterans that are coming into vet centers. We also see high trust scores with women veterans who receive vet center services. Last year was at 93%.
Okay, and I run almost out of time, but I don't see how 80,000 more employees being removed will help the VA provide services. I just wanted to ask about the return to office policy. I have been talking to a number of VA providers who tell us about VA's new rule that forces them to work in person. Those providers have been working remotely since before the pandemic, and now instead of being able to take video calls in private offices, they're speaking with veteran patients in open floor spaces where there's no privacy. This is a violation of veterans' privacy. It's a violation of HIPAA. It is leading doctors and counselors to look elsewhere for work. I am almost out of time. I just want to say that the elimination of telework agreements is really affecting our veterans' access to mental health care, and we need to have a further conversation with you about how we can fix that.
Senator Blackburn.
Thank you, Mr. Chairman, and thank you for being here and for approaching this subject today. This is one, the veterans that are a part of our team talk with me about this access to mental health services all the time. And the grief that people experience when there is that loss of life of someone that they have served with, and putting attention on the mental health needs is something that we, each and every one, should spend more time doing, and making these services available that our veterans need. this is something that is also very important. Dr. O'Toole, I want to come to you because we've talked about this, and thank you for your testimony. We've talked about what you're doing to make services available. What you have not addressed is the fact that there seems to be inconsistency of access and there seems to be gaps in this service. So if you would build that out a little bit, how are you addressing those gaps and the inconsistencies, and what is the strategy for moving forward so that people know that at the VA there is a standard of care that they can expect?
Thank you, Senator. I appreciate that, and I appreciate the way you framed it. I think this really underscores the importance of the Fox grants. And, I think it is important to put into context of the 17.6 veterans that complete a suicide every day, 10 of them have no contact with the VA, as been noted earlier. We need to be doing a better job of engaging those veterans in care. We need to be able to reach out to them. We need to be able to meet them on their terms, in their homes, in their home communities, to be able to provide those services. And this is what the Fox grants are providing for us. And this is what the preliminary evidence of the Fox grantees to date are showing progress in. So I think your question is spot on, but it very much underscores the strategic public health approach we have to really using these grants and these grantees to create that connection, and use then those connections to facilitate the trust that's needed to break down the barriers that individuals may have to actually being able to engage in care, which the vet centers are a great example of that occurring.
So how do you simplify the ability for individuals to access that care in their communities? Because we know the telehealth is important. We know that easy access is important when you're dealing with the mental health issues. But if you've got to wait on the VA and a caseworker to make up their mind, then it is something that delays you getting the care. So talk to me about simplification of that access.
Well, I think one of the best examples of there's 2 points, actually 3 points I'd like to bring up with that. The first is the issue of outreach and engagement, which again is critical to those 10 veterans a day who are committing suicide without having connections to the VA. The second is ensuring that we are effectively screening those veterans that do receive care in the VA to make sure that we are determining if they are at risk for suicide. And our risk ID, universal screening of all veterans is very much that strategy. The third issue that is critically important is that when veterans are in crisis, that we are able to effectively and meaningfully respond. And this is where I would highlight the successes of the Veteran Crisis Line that truly provide that safety net for veterans in crisis, and both the uptake and increased utilization of the Veteran Crisis Line and the responsiveness of the Veterans Crisis Line to be able to engage individuals in care are great examples. Is this saying that it's perfect? By no means. Can we do better? We have to. But I'm saying those are our 3 strategic approaches.
Well, I appreciate that. I also am concerned, and I'll send you a question for the record on the continuum of care from active duty to veteran status with those EHRs. And Mr. Fisher, I'm certain you deal with this every single day, and people trying to make certain they have access to their records so that they can get the care that they need. Thank you all for being here.
Thank you, Senator. Senator Hirono.
Thank you, Mr. Chairman. So as you testify about the need to reach out and provide the kind of services that you need to, for that you need workers. And the VA has always had thousands and thousands of positions that have been needed to be filled, and to the point where we enacted legislation to make it easier for the VA to hire people faster. And so my colleagues have pointed out several, and I'm going to add to that because does it make sense to you? This is for Dr. O'Toole. That at a time when there are some 300,000 positions that need to be filled, and you have 2,500 or so already fired, another 83,000 to be fired, does it make sense to you that this is happening to the VA?
Well, thank you, Senator. And just a clarification, the 300,000 positions in the VA are positions that are exempt from any hiring freeze.
Well, then can you tell me how many positions are needing to be filled in the VA?
I don't have that information readily available.
We're
but we
talking
can-
about thousands and thousands, I can tell you. So does it make sense to you that this is the environment that you have to live with to provide the kind of services that you're talking about, which need workers? Does it make sense to you that this is happening to the VA? Yes or no?
Well, ma'am, we are trying to do the best that we can with the resources that we have. The focus of the cuts to date have been of administrative personnel and not direct care providers.
Let's face it, there's utter chaos going on as far as I can see in the VA. So we know that a lot of veterans make up the workforce. We know that the slash and burn of the federal workforce has also impacted veterans. We know that the VA's 2024 annual report on veteran suicide identified financial loss as a significant risk factor for suicide. Do you know which veterans have lost jobs in the federal government, knowing that some 30% of federal employees are veterans, and knowing that loss of a job is a risk factor for suicide? Do you know the veterans who have lost their jobs in this administration, who have been fired?
I do not, ma'am, and I can defer that to leadership that may.
Well, it's amazing to me that how are you supposed to help these veterans with a significant risk factor, which is a loss of job, if you don't even know who they are? So it really concerns me that as you talk about the need to outreach and suicide prevention, which is an ongoing issue, that with homelessness to the VA, that you don't have the kind of information that in my view, you should have to provide the support that you need to provide. So with everything that's going on and with the tariffs and the impact on our communities, the fear that the tariffs and the potential for tariffs and the impact, do you have a sense of what the impact will be on the veteran community, of which we have millions, over 100,000 just in Hawaii? Do you know what kind of impact the tariff situation is having on the cost of everything for the veteran community?
I do not have that information, no, ma'am.
Well, you can see that this is the kind of information that I would think that you would have to prepare for this hearing. Again, for you, Dr. O'Toole. So as I mentioned, veteran suicide and homelessness is an ongoing issue for the VA. And knowing that the loss of economic security would increase homelessness among the veteran community, do you think that what is happening to the veterans in terms of loss of their jobs, et cetera, that homelessness among veterans will increase? And what are you doing about it?
Well, thank you, ma'am. So this obviously shifts gears a bit to the homeless program office. I'm happy to speak to some of the
Well, I would
different-
say that homelessness also has an impact on veteran suicide.
Absolutely, it does. And as a social determinant of health and economic stability, it's critically important. We do have several programs in place for those veterans. I think our supportive services for veterans and families and the bridge support that provides, our vocational rehab programming and others are clearly intended to provide greater economic supports for those veterans who are at risk. And clearly there is an overlap between suicide risk and economic instabilities associated with homelessness.
The thing is, Mr. Chairman, with all the chaos that is going on, not just to the VA, but every single department except for possibly the DOD, which is actually seeing an increase in potential funds, there's going to be an increase in the risk factors that would lead to veteran suicide, sad to say. So there you have it. Thank you.
Senator, thank you. Senator Bozeman.
Thank you, Mr. Chairman, and thank you, Senator Blumenthal, for calling this hearing. I was really proud to have partnered with Senator Warner years ago to introduce legislation that would eventually become the Staff Sergeant Fox Suicide Prevention Grant Program. This program created out of a dire need to improve community-based resources to address the veteran suicide crisis. While veteran suicide remains a critical issue, the VA's work and success with the Staff Sergeant Fox Suicide Prevention Program deserves recognition. Veterans who battle mental health challenges respond best to support from those that they know and trust. I need this program is critical in meeting. I look forward to discussing how we can reauthorize and update this support for veterans and communities across the country. Dr. O'Toole, it's great to hear from VA how successful the program's been. In your testimony, you mentioned that VA supports increasing the authorized funding for the program. What kind of an impact would this funding increase have on the program, and what results should we hope to see?
Thank you, Senator, and thank you for your work and efforts to get this legislation passed initially. Our hope with a reauthorization and appropriations is that we would be able to expand the number of grantees, that expansion of the grantees would both cover all of our states and geographic need areas, particularly those where access to care, access to VA care may be particularly thinned, and also to ensure that the grantees are able to effectively engage specific population groups that may be at higher risk for suicide as well. And that is our hope and aspiration with the reauthorization and appropriations.
What aspects of the program do you think have made it such a success story, and where do you see the program going?
I think the fact that these are community groups that have credibility in the communities where veterans live. These are peers. These are also organizations that are engaging families of veterans are all critical to this. The wraparound and holistic approach to really supporting those veterans is complementary to what VA does. And it really, again, creates a public health strategy and complements a public health strategy for how we're looking at suicide in a way that reflects the complexity of all that goes into it.
The legislation that Senator Warner and I introduced included reporting requirements for VA. What metrics would VA likely identify as important to collect and share with Congress?
I think the measurement dynamic is obviously critical. We need to be good stewards of the resources that Congress provides to us and make sure that the money is going where it needs to go and is having an effect. The key, as we see it, is not just it's obviously important that as many veterans are being reached as possible, but we also want to make sure that it's not just a throughput for lots of veterans, but without also looking at the quality of the care that they are getting, the comprehensiveness of the screening so that the care and the services they are getting is matched to the need, and also that we are outcome driven. We have to be focused on using this grant mechanism to be making a difference in these communities. How many of those veterans are doing better as a result? How many of those veterans are connecting in VA for VA services or in the community for community services as healthcare would require? But these are the accountabilities, these are the trackable metrics that we need to be really looking at.
Very good. Well, that's good to hear. I agree with you 100%, I think, as does the rest of the committee. Thank you, Mr. Chairman.
Well, thank you, Mr. Chairman and Ranking Member Blumenthal, for this hearing, and thank you, Dr. O'Toole and Mr. Fisher, for the work that you do to serve our veterans. Dr. O'Toole, over the past few months, I've been asking VA officials and nominees if they can guarantee that the Trump administration's plan to fire 80,000 VA employees will not result in longer wait times for veterans to get appointments and receive care. In response, the administration's nominees have told me that wait times at the VA have been increasing and reform is necessary, but they've never explained how firing 80,000 employees will help solve that problem. That's indicative of the way the administration has approached things these past few months. They have been making drastic changes without, as far as any of us can tell, any analysis or plan. Dr. O'Toole, you've worked at the VA for almost 20 years, and you're currently the VA's top doctor. Has anyone asked for your analysis on how firing 80,000 employees will affect veterans' care?
Thank you, Senator, and I appreciate the question. I am not involved in those discussions, and I will say that we actively monitor and track wait times. We actively monitor and track access.
I understand that, and again, my time is short, but the answer to my question is no, they haven't asked you for your analysis. And obviously, wait times is a piece of this, but affecting veterans' care, if somebody's been laid off who orders supplies and a doc runs out of critical supplies, that affects veterans' care, right? So have you seen or been provided with any analysis as to how firing 80,000 VA employees might affect veterans' care?
I have not, ma'am.
Have you been directed to perform or oversee any analysis as to how firing 80,000 VA employees might affect veterans' care?
Well, again, ma'am, I will say it, I am prepared here to be able to speak to this grant. I don't have the information you're asking to that.
Right, but I'm taking that you would know if you have been directed to perform or oversee an analysis, so I'm going to take that as a no as well. Last year, the VA's Inspector General released a report on several occupational staffing shortages within the VA. These are jobs that the VA was having the hardest time filling. The IG's report stated that the top clinical job in the VA with a severe staffing shortage was psychology. A whopping 61% of Veterans Health Administration facilities reported having such a shortage. Psychiatry came in third place. 47% of Veterans Health Administration facilities reported psychiatry as a shortage. As a career VA doctor, can you please discuss the role that mental health professionals like psychologists and psychiatrists play in supporting our veterans?
Thank you, ma'am. They are critical. I think that goes without saying.
Yeah.
And the complex needs and care requirements of our veterans obviously require the engagement of a very robust mental health service.
Yeah, I continue to be concerned then about the Trump administration's policies of hiring freezes, firings, and general disruption. You've talked about the exemption for about 300,000 employees, but it's really difficult to see how the chaos that is churning is going to help recruit and retain mental health professionals that our veterans really deserve access to, and you've just acknowledged, and Mr. Fisher too, has about how important they are to our veterans. Last question, Dr. O'Toole. You were the founding director of the VA's Homeless Veterans Patient Aligned Care Team program, HPACT. This program utilizes clinics with co-located medical staff, social workers, mental health and substance use counselors, nurses, and homeless program staff that form a team to provide veterans with comprehensive individualized care. I really want to thank you for your leadership on this important work. Can you please discuss the benefits of holistic wraparound care like this and how this model utilizes expertise across a variety of fields within the VA?
Well, thank you, Senator. I appreciate those kind comments. I think the hosting of that initiative in the VA speaks to a culture in the VA of trying to reach the veteran where they are.
Yep.
And meet them and their comprehensive needs on their terms, not necessarily our terms. And I think the HPACT's successes in engaging those veterans and really providing that stability that allowed them to move on with their lives and engage more fully in programming reflects it. And reflects, I think, a culture of the VA that I'm very proud to have been a part of.
And I think it does too, and I think one of the things we could really work on with that culture in place, with so many veterans being willing to do peer-to-peer outreach, is reaching those veterans who haven't engaged with the VA, who we are especially concerned about as we look at the suicide statistics. So thank you very much. Thank you, Ranking Member Blumenthal.
Thanks, Senator Hassan. Senator King.
Thank you, Dr. O'Toole, thank you, and thank you for your long service and your dedication to veterans. One of my mottos in life is that implementation is as important as vision. And we're talking about the vision now of the Fox program, but the question is, what are the implementation steps and how is it working? One of the things I've heard from the field is that the intake process is intrusive and burdensome, and we're losing veterans who are just basically dropping out of the process. For example, in Maine, we've had 311 veterans screened since they started the program. 96 of those 311 refused to participate because of burdensome paperwork or the required VA connection.
Thank you.
Veterans make it through the initial screening. 5% have stopped partway through because of the intrusive questions. Here's a practical implementation. One of the feedback I've gotten is, don't ask all those questions at the first interview. Let the professional establish a relationship. And I understand that screening is important, but we're losing some very at-risk people through the implementation process. Can you discuss this problem?
Well, thank you, Senator, and I appreciate the perspective you bring to this, because obviously implementation is the, a great vision, but if it can't be implemented, it doesn't do as much good. I think it's important to put in context these findings. This program was established as a 3-year temporary grant program to really learn from this, and those types of observations are critical. We need to find that balance between ensuring that we are asking the right questions to determine risk and to match that those needs to the services and be able to engage as much as possible, but being able to do so without scaring people away and without turning them off from those care and services is critically important. And I would defer to my colleague, Mr. Fisher, because I think the vet centers have been working in that space for quite some time. But these are the lessons we have to be using to learn to get better and do better.
My suggestion is, we're talking about reauthorization. Let's talk about examining this isn't a malicious process. It's to try to determine the risk factors and the qualification. But if that in itself ends up knocking somebody out of the process, that seems to me that's a problem that should be considered and addressed as we're talking about reauthorization and then re-implementation. I would suggest, and this has been discussed to some extent, outreach is critically important. If 10 out of the 17 suicides are people with no connection to the VA, that tells you something. And we need to connect those people, and we need to reach out to them. And for whatever reason, they're not reaching out themselves. So again, it just seems to me that's a piece of data. I want to turn to one other point. 74% of veteran suicides involve firearms. With female veterans, it's even higher. Senator Sheehy from Montana and I have a bill that basically would have the VA provide a free lockbox to veterans who ask for them. They don't have to be connected to the VA, they just have to be veterans. It's a voluntary program. But the whole idea, as I'm sure you realize, is to have some space between the idea of suicide and, I almost said the execution, that's not the right word, but going through with it. And lockboxes are one way to do that. Is this something that makes sense to you?
It is, Senator, and I think anything we can do to create space between the idea and the action is critically important, and the literature and the data support that. I know that's not one of the bills that we're here to discuss today, but the notion of lethal means safety and strategies for how to best facilitate that, including the use of lockboxes, is something that the VA is very interested in working with the committee to
I'm hoping to get
identify.
that bill in the next round, but it just seems to me that the glaring number, 74% involve firearms, that gives us a place where we need to focus, it seems to me.
Fully agree.
Thank you very much for your testimony and for your hard work on behalf of America's veterans. Thank you.
Thank you, Senator King. Senator Duckworth.
Thank you, Mr. Chairman, Ranking Member. 3 months of unjust, unconstitutional attacks on our veterans and against critical services of the United States Department of Veterans Affairs have divided this traditionally bipartisan committee, sadly. I hope that today's focus on a matter that should transcend presidential loyalty, ensuring that our veterans have access to robust mental health and suicide prevention resources, will reflect a renewed commitment that this committee will once again faithfully fulfill its constitutional responsibility to serve as an independent check on any presidential administration. Under normal times, the renewal of the Fox Grants program would be an important step in enabling the VA to continue providing critical community-based suicide prevention resources for veterans and to reach even more veterans who need this life-saving care. However, I am concerned that the Trump administration's policies continue to undermine the mental health and well-being of those patriotic Americans who have served our nation honorably. From the mass reductions in force of federal workers, including veterans working on the crisis line, to canceled contracts and continued attacks on veterans belonging to underserved communities, Donald Trump and Elon Musk are intentionally attacking morale and exacerbating the Department of Veterans Affairs' mental health workforce shortages. This threatens the ability of the VA to distribute the Fox grants rapidly. We're talking about real lives, someone's parents, child, sibling, aunt or uncle, grandparent, friend. We cannot endure more chaos at the risk of delaying the provision of mental health care and suicide prevention services. Dr. O'Toole, what specific steps are you taking to ensure that there are sufficient staff and resources on hand to administer the Fox Grant program and to provide timely care for veterans seeking Fox Grant resources?
Thank you, Senator, and thank you for your service as well as for your advocacy for our veterans. It's much appreciated. You're absolutely right. This is about ensuring that we have resources in place and a commitment to making sure that the grantees are going to be as effective as possible. The suicide prevention program reports to me. I have a weekly meeting with their leadership team. These are some of the things that we discuss, and this is a priority for us. If we're going to have to, if it's going to work, we have to make sure that we have people in place to work it.
Well, what are you doing to ensure that they are there? I mean, my own office worked a case of several folks who work on the Veterans Crisis Hotline who were in that mass firing. 2 of them have gotten their jobs back, but one of them still hasn't. And we're talking about people who, may not be the ones answering the phones. We're talking about the trainers, the people who train the other folks, the supervisors. Some of them still have not gotten their jobs back. What are you doing to make sure that there's enough people to work those hotlines and the suicide prevention programs?
Well, as I mentioned, Senator, with the Veteran Crisis Line, that is exempt from any hiring freeze, and we've actually seen a growth in the numbers of employees on the Veteran Crisis Line. Something, though, that we have to stay vigilant in ensuring that direct care is not impacted and these programs are able to function at their highest capabilities. So
will you commit to hiring some of those people back that you were fired by Elon Musk?
Well, we're happy to follow up with you on any specifics, by all means, ma'am.
I think it should be more than just the one people being handled by office. There are many people across the country who have now been laid off, who've worked on veterans' mental health programs. Those people need to have their jobs back, especially if they themselves are veterans. Do you commit to safeguarding and strengthening VA mental health workforce, including making sure they have the appropriate resources and workspaces?
Yes, ma'am. I'd like to speak a little bit to that in more direct terms. It's been referenced several times in terms of the return to office and impact on confidentiality. We are very committed, and our leadership within VHA has been very committed to ensuring that privacy is maintained and confidentiality is maintained, including ensuring that if employees need dedicated private workspace for engaging in telemental healthcare services and other confidential services that require confidentiality and HIPAA rules are being complied with. When those are not being able to be met, we have processes in place to work with the facility to ensure that either space is found or that there are appropriate pauses to the return to office. This is critically important. We cannot let this compromise the care we provide to our veterans.
Well, will you commit to advocating for protecting these mission-critical staff from adverse administrative actions, especially if they report that they're not getting the resources that they need?
Yes, ma'am, and we do that now.
Okay, because again, we've dealt with people who've had to take phone calls in their cars in the parking lot because there was no confidential space for them to do their work, their jobs.
And we have mechanisms in place to try to ensure that that is not happening. And if those are happening, we need to know about it.
Okay. Thank you, Mr. Chairman.
Thank you, Senator Duckworth. Senator Gallego.
Thank you. I was just going to ask, moving on to Mr. O'Toole, following President Trump's executive order on the return to work, the VA issued its return to work mandate requiring most employees to return in-person work. So kind of following up on the therapists who are hired as remote workers and kind of what Senator Duckworth has just said, have you heard of any instances where therapists have had to had awkward and or I would say not professional settings when they're having their healthcare or when they're having their veterans are having the therapy sessions?
I have not heard specific situations where that may have occurred. I have obviously heard it second or third hand. We have a mechanism and process in place. Those work environments and work scenarios are not acceptable to us. That's not appropriate care standard for the VA. And if they do occur, we have mechanisms to ensure that they can be remediated.
Okay, and then just kind of along the lines, there's an 83,000 person cut of VA workers coming. Is there a standard of who is going to be in that cut? How many will be therapists? How many are going to be different, different professions? Because that will also obviously affect the healthcare outcomes. It's hard to get some of these therapists into this job. Some of them can be much better paid in the private sector. So losing therapists to these arbitrary cuts, in my opinion, it's going to be very detrimental to the mental health of these men and women.
I do not have specifics on that information and would have to defer, and we'll have to get back to you on that.
I mean, for example, my Phoenix VA, the VA that I've belonged to, has a memo out that they have to cut 15%. But what does that mean? Who is that they're cutting? Mr. Fisher, I'm sorry, I can barely see your name. I have bad eyesight. So I placed a blanket hold on all President Trump's nominees to the VA, especially following the fact that they're cutting 83,000 jobs, because I just don't see how it's possible for the VA to fire so many of their employees without it affecting care for veterans, especially in mental health care. You lead the office of the VA in charge of helping veterans transition from military to civilian life, which is extremely important, right? If we can make that transition, the likelihood of people falling into some bad times, reduces tremendously. So it's extremely important work. Now, due to these cuts, veterans can lose access to that mental health care and potentially, creating and rising instances of suicide. What directions have you received specifically from the Trump administration in order to enact these cuts to the VA workforce? Will you commit to ensuring that the VA mental health providers are not among those fired or other positions that are very important in kind of keeping that network together of a very important job, I think, that you have and we all have here?
Thank you, Senator, for the question. Similar to what Dr. O'Toole brought up, I have not received guidance. Our focus at vet centers has been the hiring of our counselors as well as our outreach staff. We continue to do that. In locations where we have a hard time hiring those, we leverage all existing authorities, whether that's our scholarship program or other special incentives, to be able to ensure we're bringing those staff into vet centers.
And just to be clear, you haven't received any directive and any orders from VA Collins or anyone else from the VA saying you have to cut X amount of people by X amount of date from the programs you guys oversees. Is that correct, Mr. O'Toole?
That is correct.
Okay. And then Mr. Fisher?
Same answer, yes.
Okay. And there is, and from your general understanding, what is the deadline that the VA has set for them to cut these 83,000, let's say, positions?
Sir, I don't know, and I would have to defer on that.
Okay. Mr. Fisher, do you know?
I would have to defer as well, sir.
Okay. Well, my concern is because in Arizona, the memo that was laid out was that they wanted cuts to go into effect by July 1st, and we're already in May. And, you know, such sudden cuts, especially when it comes to kind of a mental health care clinics, VA clinics and suicide prevention, could be extremely damaging since you're trying to recruit people into this very hard work. And at the same time, they're hearing about these firings. It's going to be hard to recruit and retain. And I don't know if you've seen have you had any conversations with some of these potential therapists that are asking questions about whether or not they can come on board with the assurances that they're not going to be fired or let go later? I don't know, Mr. O'Toole, have you heard anything from potential employees? Please.
I have not. I will note, though, that the direct care providers, of whom therapists are exempted currently from any of the hiring freezes that are taking place.
So they're exempted from the hiring freeze, but not necessarily from the attrition, or from the potential elimination?
I'm not, again, sir, I would have to defer on that because I'm not aware.
Okay. So I yield back my time.
Thank you. Thanks, Senator Geiger. I have a few questions while we're waiting for the chairman to return and start the second panel. And I don't know whether, I don't think anyone has asked about this fact, but the veteran suicide rates in Connecticut seem to have been highest among veterans who are over 75 years old, lowest in the age group 18 to 54. Is that true nationally?
I don't know, sir. I'd have to look at that. There is a bimodal nature to the incidence of suicide. We see it high, very high in the 18 to 39 range. For different reasons than we see it in the older populations, where chronic disease, chronic pain, and other factors can play a more active role. But I don't have the specific data that you're referencing. Would have to take it for the record.
Could you try to provide that data? I assume that if it's available for Connecticut, it's available elsewhere. Is there any explanation for disparities between different parts of the country or different states, so far as you're aware?
Again, I'd have to defer that to our subject matter experts. It's an important question. It has a lot to do, I think, with levels of engagement, lethal means availability, and so forth. But I would prefer deferring that, and we can get that information to you.
I think it's an important question. Both of those are important questions because if there are lessons to be learned from some states and what they do in preventing veteran suicide, maybe they can be adopted more broadly. And I want to just finally ask you to have a look at the BRAVE Act. You know, if we had a few hours more for this panel, I could go through each of the provisions. The standard response of the VA to many of these provisions was to oppose it because they said it was not necessary. Now, an example would be to give more priority to women's health, mental health care. And they are saying to me that, for example, the requirement for the Department of Veterans Affairs to modify the REACH Vet program to incorporate risk factors weighted for women veterans is not necessary because we're already on top of it. We got that problem. Well, I'm not so sure that's accurate. If it ever was correct, it certainly is not now. I would ask you, Dr. O'Toole, to please go back and look at the BRAVE Act and perhaps speak with your colleagues about giving me some more, maybe different and more constructive reactions to the BRAVE Act. Thanks, Mr. Chairman.
Thank you, Ranking Member. Senator Slotkin.
Thank you, Chairman, and thank you to our nominees for being here. I'm a former CIA officer. I did 3 tours in Iraq alongside the military. I've served very proudly both Democrat and Republican administrations as a civil servant before I was elected to Congress. And I think everyone on this panel, Democrat or Republican, believes that when we make the choice to send men and women into war, we have a responsibility when they return, and that veterans deserve the gold standard of care. And as I've been on this committee and I was on the VA committee in the House, it seems like every time there's a threat to veterans care or we need to expand veterans care, it's veterans who are pushing and advocating for that change. It doesn't happen in a big bureaucratic system just by sitting there. I am concerned that mental health occupations are the ones where we have significant vacancies across the VA. Over 60% of VA facilities report shortages of psychologists, and nearly half reported shortages of psychiatrists. And I was just at the VA hospital in Saginaw this past week, and there's definitely shortages across the mental health architecture. And there's no way for me to square that with the threat of potentially cutting 70 to 80,000 VA employees. I don't understand how we can add by subtracting. And while I keep hearing from the secretary of the VA that we're not going to cut the hospitals and the nurses and all that kind of stuff, all those support steps, the suicide hotline, all the folks who process claims so that veterans can get care, they are quite literally seem to me to be on the chopping block. So tell me what you're going to do, Mr. O'Toole, in this moment of subtraction from the VA to actually ensure that our veterans get the mental health care that they need.
Thank you, Senator, and I appreciate the comments and the observation, and it's shared. You know, we have a healthcare workforce, not limited to the VA, is struggling to fill needed positions across the board. And long before this past year, we've actively tried and have been trying to continue to attract people to work at the VA, which is, I've been here for 20 years. It's it's where I choose to work. Mm-hmm. The commitment is to ensure that direct care is provided and not compromised by these cuts. I'm not privy to the decisions and the discussions and would have to defer on the specifics to that. But just as I mentioned in relationship to telehealth care, our utmost and absolute commitment is to providing the best care possible and not compromising it by any means in the process of the changes underway.
Yeah, I do not doubt, not for 1 minute, your mission and your belief in this mission. My concern is that you could be overseeing a component of the VA when you say we don't want to compromise care. In fact, we have an obligation as a country not to compromise veterans' care, and yet we're talking about cuts of potentially 80,000 people. And the Secretary of the VA refused to dismiss those cuts when he came to Howell, Michigan, a few weeks ago. He was asked directly, and he said, well, difficult choices essentially are going to have to be made. So I'm not seeing how the math is going to work out there. I also want to note that in the 2024 National Veteran Suicide Prevention Annual Report, which you may have had a hand in, it said that most veteran deaths by suicide are among veterans who have not had access to VA care in the prior 2 years, right? That if you're kind of in the system, getting care, you have a better chance of being helped. But if you're out, you're not connected to the VA. So I would actually posit we need to be getting to more veterans. We need to be doing better outreach. The VA needs to be talking to people when they separate and getting them in the routine of accessing all those services. So in fact, on this mission, not only are we understaffed right now, but I think the mission is greater than what the VA is already doing. So I would just note, you're going to be the guy in the room when these cuts come down from on high. Mr. Collins sat in your very seat and said, I'm not going to let anything compromise care, and then seems to be supportive of 80,000 cuts. I'd ask you to stand up for veterans. It's bigger than any one administration. We have a responsibility, and I know you care about that mission. So appreciate that and appreciate you being here.
Thank you, Senator. Dr. O'Toole, let me just ask a quick question. It's a bit outside, I think, the realm, but there's been a lot of conversation about staffing at the VA from my colleagues and I. And I want to highlight that the importance of community care, the Mission Act, in the way I look at things, is a way that, in fact, choice came about in an effort to help further staff the VA, and particularly in mental health, where there's a shortage of mental health providers everywhere. It would be comforting to me for you to confirm the value of the Mission Act and community care.
Yeah, thank you, Senator. And absolutely, community care, care provided in settings that are not VA for our veterans is very much part and parcel of the package of care that we provide and needs to be considered, because the bottom line is we want our veterans to get care.
Thank you. We'll dismiss Dr. O'Toole and Mr. Fisher. Thank you for your testimony. Thank you for your service to veterans and for your appearance here today. And we'll call the second panel to the table. Testifying on today's second panel is Jim Moran, the President and Chief Executive Officer of American Warriors Partnership. Jilly Cantor, Director of Evaluation and Capacity Building, Danilo. There's no reason for me to make a fool of myself one more time, so thank you for being here. She is with the Institute for Veterans and Military Families, Syracuse University. Stephen Crow, Staff Sergeant Parker Gordon Fox, Program Manager, Oklahoma Veterans United. Heather Barr, U.S. Marine Corps veteran assisted by a grantee organization. And Austin Lamberth, U.S. Marine Corps, a veteran assisted by a grantee organization. And Lindsay Church, Executive Director and co-founder, Minority Veterans of America. Thank you all for being here. And Mr. Lorraine, let's begin with you.
Chairman Moran, Ranking Member Blumenthal, and esteemed members of the committee, thank you for the opportunity to testify today on behalf of America's Warrior Partnership. You're considering 4 important bills that impact the well-being of all veterans. I'll focus on the impact of the Staff Sergeant Parker Gordon Fox Suicide Prevention Grant Program, commonly known as the Fox Grant. At AWP, we view suicide and deaths of despair prevention not as a single program, but as an outcome of veterans' restored sense of purpose and improved quality of life. Our model is rooted in proactive outreach and engagement, trust building, and sustained relationships, which we do at scale. We strive to forge these connections before the crisis begins. That's where the Fox grant has been essential. Of the 545 veterans we've screened who reported suicide risk, 94% were not initially seeking mental health support. They face challenges such as economic insecurity, navigating the VA system, and fractured personal relationships. The importance of asking the right questions early and having someone listen cannot be overstated. Thanks to the Fox grant, we've intervened early, connected veterans to local resources, and remained a consistent presence. Just halfway through this grant year, AWP's screened 1,300 veterans with 10.8% disclosing suicide risk. Since the grant's inception, that number has totaled 2,100, with 25% of the people that are veterans that we talked with and screened disclosing some level of risk. These are not just statistics. They're lives saved because someone cared enough to ask and listen. However, there is room for improvement. While the HOPE Act makes great strides, outreach must be reestablished as the program's singular focus. We must get upstream and follow the data of who is at greatest risk. The who is so important. Our Deaths of Despair study, Operation Deep Dive, in partnership with Duke University School of Medicine, allows us to follow the data of the who is most at risk, based on the community where they live in. The pathway from community identification to VA must be more transparent, quicker, and less burdensome. Congress should require the VA to establish a simplified intake process for veterans already screened by grantees, one that avoids redundant questions and respects the veteran's time and a critical situation. We also support codifying the emergent suicide care section. In many cases, AWP uses the 988 crisis line for veterans for immediate need. Formalizing this connection enhances safety and saves lives. Accountability is another key. AWP holds itself to the highest standards. Routine audits, transparent reporting, and a sharp focus on Title 38 beneficiaries. Title 38 funding must focus on veterans and their families. We recommend that Congress require verifiable metrics from all grantees and a regular reporting to ensure the taxpayers' trust is upheld and that those not meeting the standard are reevaluated. We support the use of the Columbia Protocol as the sole requirement screening tool. The current requirement of multiple follow-up assessments is overwhelming and deters engagement. Let's reduce bureaucracy and focus on care. We strongly support the provisions in the HOPE Act that allow the Fox grant funds to be used for transportation. We do a survey every year, and the lack of transportation is the top barrier veterans face, especially when those are in crisis. Grantee funding is another consideration. AWP could double its outreach efforts if the funding ceiling was increased to $1.5 million. While this isn't necessary for every grantee, organizations that have proven outcomes, capacity should be empowered to do more, provided the metrics and reporting structure are in place. Regarding the BRAVE Act, we support a deeper analysis of veteran suicide and its risk factors. Still, discussions also must address the role of traumatic brain injury, a silent killer we are not doing enough to confront. Finally, we support the Every State Counts Act to expand the Fox grant access to underserved states. In the meantime, AWP stands ready with our national network to assist when necessary. Members of the committee, thank you for your continued leadership and support. Your efforts to saving lives. At AWP, we stand ready to keep doing our part to serve, to listen, and to ensure the vets are known. Together, we can do better.
Mr. Moran, thank you. Ms. Cantor.
Mr. Chairman, Ranking Member, members of the committee, thank you for the opportunity to offer testimony on behalf of the Daniello Institute for Veterans and Military Families at Syracuse University. The IVMF perspective is rooted in research along with more than a decade of experience working with 26 communities across the country. These communities are connected by a common goal: improving coordination between organizations that provide clinical and non-clinical care, so together we can help veterans thrive. So, what have we learned? As we know, the rate of suicide among veterans remains too high, higher than among civilians. Data has also shown that each additional non-clinical stressor, such as financial and housing instability, is linked to increases in the likelihood of suicidal ideation. States, counties, and community-based organizations can often best address these needs. In a study we conducted with the VA, we found a majority of veterans served by our partners were also enrolled in VA healthcare. For these veterans, their stressors were most effectively addressed when communities and VA medical centers worked together. At the same time, the study demonstrated that communities are in fact reaching many veterans not connected to VA healthcare, a group that represents over half the veterans that die by suicide. The Fox grants recognize and leverage the role communities play in suicide prevention. It creates new formalized avenues into clinical care, and it supplements that care with wraparound services so that we can address root causes at the same time. We are grateful to this committee for looking upstream as part of the Hannon Act to invest in this evidence-based coordinated approach. The reauthorization currently under consideration is therefore critically important. Since the program's launch, the IVMF has offered ongoing support for 11 of our partners who have been awarded these grants. They have stress-tested this program and identified its strengths and challenges. While there is always more that can be done, many of the proposed changes directly respond to their feedback. There are three main target areas that I'd like to address today. First, program coverage and expansion. Increased funding, both overall and for administrative and incidental costs, will enable grantees to scale and reach more veterans in a way that builds trust in non-clinical settings. These individualized, peer-based approaches to outreach are both backed by evidence and just common sense. A simple gathering over pizza or coffee can open the door for a veteran to reach out for help. Allowing reimbursement for transportation and ride shares to appointments will also be beneficial. Whenever possible, the cost of an Uber ride should not be the barrier that stops a veteran from getting the critical care that might save their life. Second, screening and eligibility. While some of our partners support the Columbia Protocol as the main required screening, others would prefer more nuance in when and how it's used. The proposed training on the tool will mitigate some of these difficulties, but overall, we hope the intake process can balance evidence-based assessments with burden considerations for both veterans and program staff. And third, VA collaboration and compliance. Most importantly, we strongly support the provisions designed to hold the VA accountable for their role in making this program successful. Our partners have routinely experienced inconsistencies in awareness and compliance by their local VA medical centers. Once a veteran has been deemed eligible for the program, VA enrollment must be streamlined with a dedicated process such as an automatic high-priority group assignment. We also appreciate the proposal to expand emergent suicide care coverage if the VA is not responsive. This provision will ensure grantees can effectively help veterans get the care they need. In conclusion, the evidence for reauthorizing the Fox Grants program is clear, and the proposed legislation aligns with many improvements sought by our partners. We deeply appreciate the committee's steadfast commitment to increasing our investment in prevention so that this critical program can reach more veterans before they are in crisis. Thank you.
Thank you. Senator Crow.
Chairman, Ranking Member, and members of the committee, thank you for the opportunity to testify today. My name is Stephen Crow, a retired Gunnery Sergeant of Marines with tours in Afghanistan, Asia, Africa, Europe, and Central America. I now serve as the Program Manager for the Staff Sergeant Parker Fox Suicide Prevention Grant at Oklahoma Veterans United. Our program exists to prevent suicide among our nation's veterans by removing barriers to care. The Fox Grant was created precisely because the system was not working for too many veterans. Through the Fox Grant, OKVU has built a statewide veteran-centric approach that reaches across rural and urban communities. Over the past 3 years, we have engaged over 5,000 veterans and supported or led more than 800 outreach events. We have formal collaborations with major veteran employers across the state, consistent engagement at Fort Sill, and we hosted the first multi-grantee veteran stand-down in the country alongside the Cherokee and Choctaw nations, drawing veterans from across Oklahoma and 5 other states. At the core of our work is sustained trust and empowerment. Veterans who succeed often ask, how can they help others? Proving that when we lift one, they turn to lift many. However, we face significant barriers. Chief among them is the required use of the Columbia screening tool. Though well-intentioned, it often drives veterans away. At a recent grantee conference, it was reported by one grantee that 13 veterans died by suicide after either refusing to complete the Columbia or answering no to every question despite the clear need these veterans were in. Worse, grantees are instructed not to track veterans deemed ineligible for the program, which creates a very dangerous survivorship bias. Another persistent challenge is the absence of a national referral process between grantees and the VA. No two facilities operate the same way, and even within a single state, these can differ dramatically. Local VA staff often defer to central office guidance, which has not materialized into actionable support. Veterans like Parker found solace in physical activity and music, yet grantees are restricted from funding low-cost gym memberships or instruments despite VA's own research supporting these therapies. VA guidance currently prevents us from delivering the very solutions their studies endorse. Transportation remains another major barrier. Guidance recommends Uber and Lyft, yet these services are non-existent in rural communities, and these are the areas that we primarily serve. We currently need a national community of practice to unify efforts, and I can say Oklahoma Veterans United has already developed internal models for cross-county collaboration and is ready to lead this initiative across the nation. Another great benefit that would be a good add to this program would be the ability for grantees to hire an LPC or an LCSW to be that gap fill whenever there is a wait time for veterans to get care at their local VAs. We think that in a 2-month period, 4 to 6 sessions with an LPC or LCSW in our direct team could be a very critical gap fill that would get someone into VA and let them have the patience to wait for those appointments to materialize. In the military, I was taught, if you see something, say something. For 3 years, we have raised these concerns to VA leadership without meaningful action. Veterans' mistrust of the VA did not happen overnight, and winning it back requires real, tangible change. If the rate of 17.6 veteran suicides per day is accurate, then we have lost over 16,000 veterans since this grant started. Yet when a veteran stabilizes, the first thing they ask is, how can I pay it forward? Veterans want to be the champions of the system, and if the system works for them, I guarantee they will be. The VA has good intentions, but they lack timely execution and consistent communication. We believe that with clear guidance, national coordination, and policies grounded in real-world realities, we can save lives and help veterans live lives worth living. We believe Parker's legacy must guide the future of this program. If he had access to these tools we propose, he might have remained with us longer. Let us not waste the opportunity to honor him through this meaningful change. And thank you for your time and your commitment to our nation's heroes.
Thank you. Ms. Barr.
Good afternoon, Mr. Chairman. Good afternoon, members of the committee. Thank you for this opportunity to share my story about this program and how it helped. My name is Heather Barr. I was a sergeant in the Marine Corps, served for just over 5 years, did 2 deployments, one to the Middle East, one to the Indo-Pacific. I was honored to be discharged from the Marine Corps in September 2023. Went on terminal leave a month before that, so this was 2 months post-deployment. Returned from a deployment next week, transition seminar, and then was out in 2 months. I had no plan, no idea what I was supposed to do. Just was moved back into my family's home in South Carolina. Felt like I was back at square one, basically. Living with my mother, no prospects for the future, and didn't know what I was doing. I ended up reaching out to the local vet center to try to find counseling and a therapist for mental struggles that hit me during deployment and then just were expedited and grown by transitioning out of the Marine Corps. They then pointed me to the Upstate Warrior Solutions, who are in Greenville Veterans Organization, who are partially funded by the Staff Sergeant Fox program. While I was there, I was screened, found at risk, and they set me up for success, basically. Made sure I was continuing to go to therapy and things like that at the vet center. Were able to actually provide a way for me to get a job. They showed me ways to do that. That was the first employment out of the military, thanks to Upstate Warrior Solutions. Part of the big change in transitioning for me was being completely disconnected from the military lifestyle and people I had been around for the past 5+ years. Coming back from a deployment, trying to transition to just normal military life, and then to civilian, what had put me in just a tailspin. I felt like I was just drowning and was pointless and purposeless without any guidance. So Upstate Warrior Solutions, the Staff Sergeant Fox program, helped provide that to me. They helped me get a job, made sure that I was engaging with veterans and community where I could actually relate to, and I could realize that I wasn't actually completely alone, and there were other people who actually understood what I was going through or had been through. So I was extremely, extremely grateful for that. My scenario is an ideal scenario. My family was available for me to move back in with. Financial struggles were there, but thankfully, within a few months of getting out of the military, I was set up with Upstate Warrior Solutions in the program. That is not always the case. I know many people who have gotten out, they do not have families to go back to. They have either poor relationships or they're just non-existent. So mine is basically the best case scenario. I had family to go back to, but not all do. And regardless of if you're enlisted, officer, female, male, you have dependents, don't have dependents, all these things add up, both financial difficulties, and then some have PTSD, anxiety, stress-related things that just compound on the already trying time that transitioning out of the military is. And the Upstate Warrior Solutions was, and the Staff Sergeant Fox program was definitely a life ring that I was very, very fortunate to be provided. It did take a lot of searching, but I was very, very fortunate to be thrown that life ring that not all people are. Since 2022, I finished completed the Staff Sergeant Fox program in August of 2024 when I left the state. They reached out to me multiple times, even though I was out of the program, actually showing they cared, dependent or not if I was relying on them for anything. They wanted to make sure that I was taken care of as a veteran. I'm very, very grateful for that. Since 2022, UWS has also completed the Staff Sergeant Fox program with 20 other veterans and currently have 164 active members within their program. And it's just a great outreach for those who have struggles finding other outlets or just need help when they need. So thank you. I appreciate it.
Heather, thank you for your service to our country, and thank you for your testimony. Austin?
Good afternoon, Mr. Chairman Moran and members of the committee. My name is Austin Lambright. I just want to start by thanking everyone for the opportunity to be here. I'm deeply humbled, not only for the opportunity to serve my country, the greatest country in the world, but also to be here and speak on behalf of the veteran community and offer some insight on support based on my experiences. I'm here from South Carolina. In 2006, at the age of 18, I enlisted in the Marine Corps to serve as an infantry machine gunner. I did 2 deployments to Iraq in 2007 and then 2008 and 2009, and I was honorably discharged from the Marine Corps in 2010 at the rank of corporal as a squad leader. During my time in the Marine Corps, I completely engulfed myself with the mentality of going to combat. during the peak of 2 wars in the harshest conditions possible that Marines are sent to. I earned my combat action ribbon when I was 19 years old in Ramadi. I was just a kid, and at the time I felt about as close to invincible as I could possibly feel, although foolish, that was my feeling. I had a purpose and a driven focus for my life with the support from loved ones at home that projected me into being a successful Marine and squad leader on my second deployment. Both of my deployments were to combat zones. I'm very fortunate to have the family that I have at home. Very hardworking father. He's a deacon at church, and a mother that's as close to an angel as any human that I've ever met. When I transitioned out of the Marine Corps in 2010, I moved back to my hometown in Easley, South Carolina, bought my first house. And I was somewhat of a reckless wrecking ball at first. I was mad at the world for my experiences, the outcomes of how the war played out, and just the current state of Americans in my generation. In those 18 months' time for my EAS, I had been arrested 3 times for driving under the influence. I went to jail a handful of times on violent-related charges, and I had an unexpected child who is now 12 years old, my son. During this time of those 18 months, one of my Marines had committed suicide. The first experience that I had with a Marine of mine committing suicide actually happened on my second deployment, where Lance Corporal Robert Ulmer took his own life in our living quarters. So during this time when I was struggling really bad with some of the decisions that I was making, that 17.6 per day suicide number really started creeping into the back of my mind and became an option. In fact, 5 Marines that I deployed with to Iraq, since we've gotten out, have committed suicide to this date. Moving forward, I said I had an unexpected child, so my child, Jackson, he gave me a new purpose and made suicide feel like it couldn't be an option because I would leave my son alone in this world. My son's birth was a turning point in my life, and it's when I became connected with Upstate Warrior Solution. I began reaching out for help to better myself because I wanted to be the best father I could for my son. I quickly made common connections with other veterans at UWS, for example, Nate back here and another gentleman named Scott Hicks. Both of them I had strong connection to because of similar experiences, and they had been through some of the dark tunnels that I was going through at the time. However, they had made it through and were living very successful lives, good fathers, and they had something that I really wanted. So I found a commonality of mindset. I felt as if I was not just alienated in the general public. I was able to be real about my problems with these gentlemen and gain advice from them who have experiences similar to mine but overcome the same struggles. I'm going to run over if that's is that okay? Thank you. I'll try to be quick. Thank you, sir. Moving quickly, I learned that I'm not invincible by any means. My choices and decisions moving forward directly influence my way of life and leadership for my son. This was a key period in my journey that really turned the course positive. I would have been suicidal or landed myself in prison or the grave, surely enough, had I continued down the road I was on before my son was born and I got connected with UWS. As time progressed, I went through a divorce, job changes that really got me in the dumps at times, and these times I would reach out to UWS for support to keep my head on straight. I was invited to and participated in golf tournaments, dinners, hikes, other events that gave me a sense of positive community that I could take a pride in being a part of. In October of 2022, Upstate Warrior Solution helped me get connected to the Vet Center for Mental Health Counseling. I was in one of my darkest ruts at the time. I was suicidal for months. And in February 2023, I reached out to Upstate Warrior Solution for help again and agreed to participate in the Staff Sergeant Fox program. As a Staff Sergeant Fox participant, I received inpatient and outpatient care from both VA facilities and non-VA. I received care for PTSD and alcohol abuse, with a lot of time and focus spent on post-combat stress and my personal experiences. I also participated in Upstate Warrior Solutions recreational programs and received peer support from them. When I went to get inpatient mental health therapy, I missed my son's 10th birthday. However, the way I explained it to my son and the mentality I had was, I can either miss his 10th birthday or I can miss all of them. So I took that opportunity, and it was one of the best things I ever did. I also want to note that I've always claimed to be a Christian man since I was saved at 12 years old. However, I never truly followed the lifestyle and choices that Jesus had directed me by his actions and words in the Bible. Last year, in April 2024, I was rebaptized in the presence of my son, my mother and father, and my life drastically changed. Seeking God's purpose for my life and putting all my focus and energy on that cause for myself has been life-changing for the better. The care and help that I received through the Staff Sergeant Fox program saved my life. I had been out of the Marine Corps for 12 years before I asked for help. It took me 12 years to get to rock bottom. And at rock bottom was the untouched trauma that I experienced while I was in the Marine Corps. And the losses I experienced since that time as well. Loss of veteran friends, loss of marriage, loss of purpose. For over 2 years, my mental health and well-being were made a priority by the VA, Upstate Warriors Solution, and my community, but most importantly by me. I exited the Staff Sergeant Fox program in April of this year. When families, friends, local organizations, and fellow veterans actively participate in creating a supportive environment, it helps build a strong network of care and understanding. This sense of connection and shared responsibility makes a profound difference in the lives of veterans, reminding veterans that they are not alone and that our lives really do matter. Completing the program gave me the tools not only to take better care of myself, but to be there for my brothers and sisters in arms. I'm proud to have taken that step because asking for help is a strength, not a weakness. I hope and pray that this program, the Staff Sergeant Fox program, will not only be continued, but also expanded to include other avenues of resources like legal assistance, financial literacy, that will also include veterans with eligibility limitations. Thank you for your time, and God bless.
Thank you for your presence here today, your ability to tell us your story, and thank you for your service to our country.
Thank you.
I'm going to go vote. I'm going to call on Lindsay Church, and then I'm going to yield my time to Senator Tuberville, and then Senator Blumenthal will chair the meeting until I return from the vote. So, Lindsay Church.
Thank you. Chairman Moran, Ranking Member Blumenthal, and members of the committee, thank you for the opportunity to testify today. My name is Lindsay Church, and I'm the Executive Director of Minority Veterans of America. Our organization serves veterans who have been historically excluded and underserved. Women, people of color, LGBTQ individuals, religious minorities, folks with disabilities, and those living in rural communities. We're not side stories in American military service, we're central to it. Yet, when we return home, we face systems not designed with us in mind. Today's hearing acknowledges a crisis many of us have been warning about for years: the growing distance between service and survival, especially for those at the margins of visibility. Since October of last year, we know of at least 13 veterans who died by suicide on VA property. Another 13 transgender, non-binary, and intersex veterans have attempted suicide, compared to just 1 last year. If this rate continues, we're on pace to exceed the highest number of veteran suicides recorded on VA campuses in a single year. These aren't isolated incidents. They're a reflection of a system that is not only broken, but actively weakened by policy choices that erase the unique experiences and barriers faced by our nation's most vulnerable veterans. Instead of fostering trust, transparency, and targeted services, we've watched as this administration has taken steps that endanger the veterans most in need. In the past 100 days, VA rescinded VHA Directive 1341, eliminating protections for respectful, clinically informed care for transgender and intersex veterans, as well as access to crucial life-saving health care. Critical language acknowledging race, gender, sexual orientation, disability status, and accessibility was stripped from the forthcoming congressionally mandated report of the Outdoor Recreation Task Force for Veterans, which we sit on, effectively erasing marginalized veterans from national policy recommendations. Outreach materials acknowledging LGBTQ veterans, women, veterans of color, and disabled veterans have been sanitized or eliminated altogether. Efforts to suppress data collection on sexual orientation, gender identity, race, and ethnicity have intensified, making disparities easier to ignore and harder to address. These aren't bureaucratic oversights. They're deliberate choices with deadly consequences. When we erase identity, we erase risk. When we erase risk, we erase responsibility. When we erase responsibility, veterans die. We confront these realities every day, not in theory, but in lived experience. That's why our organization provides transitional housing for LGBTQ veterans experiencing homelessness. We deliver flexible financial assistance to veterans in crisis. We train minority veteran leaders and providers in culturally competent care. And we create spaces, indoors and outdoors, where veterans can heal without hiding who they are. These interventions are suicide prevention. We've learned that connection saves lives, that trust saves lives, that access to mental health care that affirms identity rather than denying it saves lives. That's why the bills before you today matter. They offer opportunities to not just bridge gaps, but repair the foundation of trust that's been so badly damaged. That opportunity will be lost if we fail to embed equity at every step. We must prioritize equity in grant funding, not as a bonus, but as a core requirement. Mandate cultural competency trainers for all, or training for all providers serving veterans. Require disaggregated data collection so we can identify and address the disparities that put minority veterans at greatest risk. Invest in partnerships with trusted, community-based organizations already doing this work. Outreach without intention isn't outreach, it's optics. Access without safety isn't access, it's abandonment. And visibility without action isn't progress, it's betrayal. We're not simply facing an outreach problem when veterans drive onto VA campuses and take their lives in their cars, or when transgender veterans struggle to walk into VA clinics because they're afraid to reveal their identities. It's not just an outreach problem when women veterans report being re-traumatized by providers who don't understand gender-based trauma. We must acknowledge it that we're facing a systems design failure, one worsened by political decisions to erase the identities most in need of protection. We cannot afford half measures or sanitized language that hides disparities behind one-size-fits-all solutions. We cannot afford to lose another life to silence, indifference, or fear. This isn't just a matter of mental health policy. It's a test of whether our government is willing to see and serve all who have served. Veterans deserve more than visibility. We deserve systems that are worthy of our trust, our lives, and our sacrifices. This is our chance, right now, to build these systems, to not only acknowledge veterans like me and those sitting behind me, but to fight for us, regardless of our identities. Not with empty promises, but with bold action. Bold enough to save our lives. Thank you for the opportunity to testify. I look forward to your questions.
Thank you. Senator Tuberville.
Thanks, Senator. Good morning, everybody. Thanks for being here, and thanks for those of you that have served this great country. Thanks for your service. Since I've been on this committee now going on 5 years, we have not improved prevention of suicides. Matter of fact, in a lot of areas it's gotten worse. I know in my state of Alabama, you can throw all the money at it you want. But at the end of the day, it's about attitude. It's about the people that work in these hospitals and these care units that show care and humility for the veteran. I've had friends that have committed suicide. I've had friends that have almost committed suicide. It's a sad state of affairs. But again, I think it's more about people. We have to have people that's going to do the right thing. Veterans, there's no area that we need to concentrate more in our country other than obviously our economy and things that are going on, but the care of the people that have put their life on the line for our country. Mr. Lorraine, opportunity for oversight on these grants. Do we have enough oversight in your eyes for the grants that we're putting out, the Fox grants?
Thank you, Senator. I think if there is oversight, it's not transparent. We do participate. America's Warrior Partnership participates in all the meetings that the VA holds. We provide our reports. We just don't know how we rack up against others, and we don't understand where we are, how we can improve what we're doing. So if the outcome of oversight is to change the process and improve the process, we're seeing it a little bit. The technology system that the VA was using previously has improved greatly, but I would say it's not exceeding expectations on oversight.
how can this VA and this administration stop the bad actors from taking these grants away from people that actually need these grants?
Well, sir, there's an example of a grantee in the Northeast who was prosecuted for $50,000, taking $50,000 from the grant. I think that type of oversight is needed. We just went through our audit. We did very well with it. But I think more audits, I hate to say that, but I think more audits for organizations with clear guidelines that don't just look at how many hours are you spending doing the work, but what are the outcomes of the work that you're doing.
Yeah, and the data that we get, a lot of it's not accurate. How can we overcome? How can we get better if we don't get accurate data? Are you seeing any of you? Are you seeing a better use of data that we're accumulating? Ms. Cantor, anybody?
Thank you. I think that the types of measures that we've historically looked at in similar models, but not necessarily only connecting people to VA care, but just making referrals to organizations for services, have included things like timeliness and accuracy of those referrals. Was the veteran referred for the right thing? And then were they treated successfully? So to me, it's on a continuum of how many people are you reaching through your outreach, converting to how many people are you screening, to converting to how many people successfully get to VA, converting to how successful was their treatment. So it's really following that path. I think it's possible with a lot of the systems that many of us have used. I just think it's not, to Jim's point, as transparent as it could be about what information is available. Particularly as a non-grantee, we know very little about how things are going.
Yeah, I'll ask you this question. Do you think merit-based system of people that are showing better data, better accomplishments, more positive influences and influences, do you think they should get more grants?
You're asking that to a seasoned program evaluator, so I'm going to say absolutely yes, and I think some of the provisions account for that in the new legislation, allowing for potential additional funds to people who, like Jim, who have demonstrated good performance, or like Stefan's team, that could serve more with more funds.
The grant program started, in 2020, set to expire this fiscal year if we don't re-up it. Any of you want to answer this question? Are there any other suicide methods that we've seen? I'll ask the veterans. Any other suicide methods that we've seen to help to prevent suicide? Anything that you'd like to suggest in your experiences? Any of you want to answer anything that you've seen help? I've personally offered up to this committee about hyperbaric chambers. People say that it helps in some areas with PTSD. Some people say they don't. Well, who cares? If they help anybody, if they help one person, we should use them. Anybody want to answer that question through experience?
There's a couple non-conventional ways that I've experienced personally that have helped. I don't know if you're familiar with DMT or psychedelics, but those helped me quite a bit, using those personally, just to be able to get past the trauma and be able to, it gives you a supernatural way to kind of look at yourself and get over the things that haunt you so bad. I think those work in general for basic. I think anybody could use those to their advantage.
Were they provided by the VA?
No, sir. No, sir. I don't think it was an option.
Yeah, probably not.
While I'm here, I wanted to mention one thing. There's been multiple comments, from Senator Moran and others about the VA and funding and the budget cuts due to the amount of funding. I just want to give you one example from me personally. When I went to Wheeling Way Hospital, that the VA sent me to in Statesboro, Georgia, I saw the bill that ended up getting sent to the VA from Wheeling Way Hospital. It was $90,000 for a 30-day inpatient program. exact same person who got the exact same care but not billed through the VA, instead billed through their insurance, was $21,500. So I think there's a lot of irresponsible, maybe invoicing or spending. That's just one example. If 50 guys go to the same program, you're talking a substantial amount of money. So I feel like just the audits, like we were just talking about, that was brought up, I think that'd be a really good situation just to mitigate all of the unnecessary spending or maybe careless spending that goes on. That way there's more funds available for veterans that need and could use it.
Yeah, I think our VA secretary now is on top of that. We've got to stop the fraud and the theft. If we don't do that, we're not going to have money for people that actually deserve that. Thank you, Senator.
Thanks, Senator. I have a few questions for Ms. Barr and Mr. Lambright. Both of you, as Marine Corps veterans, went to Upstate Warrior Solutions. You didn't call the VA directly. You didn't call the Veterans Crisis Line. Could you talk about why you went there and not to the VA directly?
Thank you, Senator Blumenthal. So I myself actually searched through the VA first to reach out to try to find any type of mental health, anything. Something I'd been trying to get into through the VA while I was in, just try to get it worked out prior to getting out, and kept getting phone numbers for people who were no longer in service or no longer connected to the VA or just stonewalled over and over again through them. I thankfully found a vet center in town, and they were actually the ones who pointed me to Upstate Warrior Solutions. And Upstate Warrior Solutions were the ones to keep working through that. I think part of it is partially just due to, like, in our area there in Greenville, South Carolina, there's a very large veterans presence. And the VA does not reach out very much, nor does it announce its capabilities as often. It's definitely very much up to the veteran to try to find resources. Upstate Warrior Solutions is one that presents itself and puts itself out there more so than the VA and the vet centers do. So I think that's most likely the reason most people have found Upstate Warrior Solutions before the VA, just because they are out there putting themselves out to help and present themselves instead of making it a chore or a extreme task to try to make their way through the VA process of getting help. So, thank you.
Mr. Lambright?
Yeah, thank you for your question, Senator Blumenthal. I think what you had asked was why did I go to Upstate Warrior Solution, not the VA? I had, in fact, went to the VA first. In South Carolina, there's multiple outpatient clinics, but there is one main VA hospital in Columbia, where the state capital is. So when I was first initially struggling with suicide, I went through divorce, and I drove myself to Columbia, unbeknownst to my family or anybody, and checked myself in where they have a mental health facility there in Columbia. So they basically took my clothes, put me in a gown and some foam slippers, and for 5 days I played Scrabble, and it was a waste of time. When I left, I was more upset and in a worse place than when I got there. I discussed that with Upstate Warrior Solution, which provided me the insight and the direction to use another facility, like a civilian facility, if the VA can direct me there where I can get the care that I needed. So I did, in fact, go to the VA first. However, I had a relationship with Nate and with Scott Hicks that I mentioned, and they had experience with other veterans that were in a similar position that had gotten help from a civilian entity. So I chose that route instead, and honestly, it was the best decision I ever made. I owe my life to these guys.
Thank you. Thank you both for your service and for being here today. Mr. Lane, have you seen evidence yet of the VA cuts in staffing so far as it affects veterans?
No, sir, we haven't seen any.
How about other members of the panel? Have you seen, and when I say evidence of the cuts, I don't mean only people leaving, I mean also the sense of anxiety, worry, and so forth?
I would say I have heard that just in phone conversations following up, trying to build more program agreements between us and VA, and just in general asking, I mean, they're our peers. We care about them as well. So we ask how they're doing and what's going on. And there's definitely some mixed anxieties and some fears. We just haven't seen personally any of that come to fruition yet.
Have you heard veterans discuss it?
It's definitely asked about, sir. I mean, veterans that come into our programs or that we talk to at events, they are curious. It's in the news, so they ask about it. With us just being a grantee, I don't really have the expertise to tell them anything. I mainly just direct them over to like public affairs offices and things like that to field those questions. But it's discussed.
Can I jump in, Chairman? Or Ranking Member?
Thank you.
But first, anecdotally, you are seeing that like the centralized services that VA relies on for things like their operator services, you have to, in order to reach the VA providers, you have to call the main central like operator. It took me 7.5 minutes to get to the operator the other day. It normally takes 12 seconds. Just sitting there waiting on hold, trying to get a hold of anybody to get you to the dental clinic. You're trying, because that's the only way that you can call the actual hospital. You have providers who are worried because their schedulers are getting cut and are getting riffed. You have providers who are worried because anybody that helps support them to deliver the services are starting to get those, while the providers themselves might be exempt, the people that support them and the support staff and the scheduler, the billing, all of those things are now landing on the provider's desks. And to the point that was made earlier today, VA does not pay well enough to make them do 3 or 4 jobs in support of delivering these services. So there's a ton of anxiety, a lot of frustrations, people making impossible decisions about whether or not to take the deferred resignation, to take the early retirement, to take it, or to chance whether or not they're going to have a job in a few months. So there's a lot of anxiety, which to the point earlier talking about VA employees being veterans themselves, you've got a dual crisis happening here. You have veterans who in our community, most of us are worried about what's going to happen with the future of this agency that provides most of our health care. Then you turn to the actual side of people who work for VA. They're experiencing the mental health crisis of the VA maybe being dismantled, but also they have to work for the agency, worry about their jobs. Many of them work in billets that are now outlawed in the agency themselves. You've got a surging crisis with underneath the underbelly of the veteran community that we are going to see in next year's suicide report.
Thank you. I want to thank all of you for being here today. The chairman, Senator Moran, has another obligation, so I'm going to finish the hearing. Thank you for your participation. Been very meaningful and important to the committee. The hearing record will remain open for 5 legislative days. Should any committee members want to submit additional statements or questions for the record, and I'm going to ask all of our witnesses if there are any questions to please respond to them. Once again, thank you all for being here. This hearing is adjourned. Thank you.